Hello, I'm Dr. Lapam Panda and I'm an eye doctor by profession.
I'm basically an ophthalmologist by profession. Right now here I'm pursuing my fellowship in ophthalmic public health.
I'm not here to preach you about eye health, but share with you my experience with undergoing an eyelid surgery, as you will learn from this video.
Exactly, my eye condition is that this eye is having a mild ptosis, which means if you compare this eye, that is the right eye, with the left eye, you will notice that the left eye upper eyelid is slightly lower than the right eye upper eyelid. So that's the defect which I am having, which I want to be corrected.
Here my routine is hectic, with 3 days a week spent traveling to a rural area where I serve the community looking for eye problems. Rest of the week I spend in the clinics learning the specialities of medical retina and glaucoma. I had always noticed that my eyes looked dissimilar. One was smaller than the other. Being an eye doctor, I knew it was due to slight droop in my left upper eyelid. I gathered courage and booked an appointment to see Dr. Naik.
I talked with him and told him that I have a mild ptosis, and then he said that we can correct it completely.
The waiting area at LV Prasad Eye Institute was so plush and neat. I could relax as I waited for my turn. At first, an optometrist noted down my concerns and performed a basic eye examination. Dr. Naik saw me next and he immediately put me at ease. After conducting some measurements, Dr. Naik confirmed that it was an acquired aponeurotic dehiscence. Well, don't freak out. It just means that the muscle that is supposed to lift our eyelid seems to have slipped from its normal place a bit, leading to a droop. Much like the thread of a curtain, which, if loose, won't lift it fully. Dr. Naik told me that the surgery would be daycare and would take approximately 20 to 30 minutes under local anesthesia. He was very frank and told me that this surgery is not an exact science and there is always a minor chance of overcorrection or undercorrection that may need stitch adjustment. He was very comforting and I knew I was in safe hands.
The way he talked, that gave me a lot of confidence, and that's how I decided that I should go for the surgery.
Quite naturally, I was concerned about my facial appearance. Being an eye doctor, even patients would sometimes ask why my eyes are not perfect. So I decided to undergo the surgery. I informed my family and they were very supportive. I underwent a few necessary blood tests to make sure I'm fit to undergo the procedure.
I have applied leave only for 2 days. One is the day of surgery and one is the post-operative day 1.
The physician, Dr. Archana Bhargav, was very kind and gave me a thorough health fitness examination. The patient counselor, Jyoti, informed me that I did not be fasting and can have a light breakfast before surgery. Soon, I found myself relaxing and anticipating what lay ahead for my eye surgery. And finally, the D-Day arrived. I was made to wear a surgical gown, and yes, I was a bit apprehensive, but I had a good night's sleep and was eager to undergo the transformation.
I just thought that I have to get ready and come for the surgery, and some excitement and small amount of fear was definitely there, but nothing beyond that.
I was finally inside the operation room. The nurse and the doctor's assistant greeted me and I felt reassured and relaxed. Anesthesia cream was applied to my eyelid few minutes ago. I was then greeted by Dr. Naik and he injected a small amount of local anesthetic to numb my eyelid. My eyelid surgery procedure got underway. Throughout the surgery, Dr. Naik and his assistants were talking to me. They discussed about my daily routine at work and kept me busy talking. I actually did not even feel like I'm undergoing a procedure. In half an hour, I was told that it's over and I found myself walking back to the recovery area. Dr. Naik looked at my eyelids once again and happily said that they would be fine.
So Dr. Naik, what I could realize in the OR is that he's a very smooth and a very caring surgeon. I really feel good that now the surgery is finished and it has been done very successfully.
Those who watched my eye surgery said that there was only one drop of blood seen in the entire surgery, so that felt good too. I stepped out of the operation room and changed back into my clothes. Within a few minutes, I took my belongings and returned back to my hostel room to rest. That day, my friends came and saw me. In fact, many of them couldn't even guess I had undergone a surgery since the swelling was minimal. And yes, I talked to my mom and my dad, and they were relieved to know that all went well. Next day, Dr. Naik re-examined my eye condition and told me that my left eyelid was healing well. I was asked to continue the wound care as suggested and to review again after a week. Clinical photographs were taken at each visit to document the progress. I was happy, eagerly looking forward to the time when I would look good. What mattered was that my usual ebullient self was intact, and I was bold and happy with my decision to have undergone the eyelid surgery.
Today is the first day after my surgery. I'm absolutely fine, but as you can notice that there is a mild amount of swelling in the left eye. Yesterday after the surgery, I didn't have any pain. There was a small amount of ache for which I had taken a painkiller. And other than that, I was absolutely comfortable throughout the day.
1 week later, Dr. Naik re-examined my eye condition. It was already clear to me that the two eyes were looking symmetrical. He agreed that the eyes look symmetrical now. However, he did tell me that 6 weeks would be the ideal time to assess if any tweaking of stitches is required to make it perfect. At 1 week, I'm happy about my decision to have undergone the surgery. It's a nice feeling to have it resolved and to look good once again. I feel more confident now. I am all set to go out and conquer the world of eye care. I'm so thankful to LV Prasad Eye Institute for comforting experience under caring hands.
There was no need of any suture adjustment in this case, and as you can see that there is an excellent symmetry between the two eyes. So obviously it's beyond words. I would like to recommend that anybody who is having a mild or moderate form of ptosis should always undergo a checkup and undergo the surgery if at all needed.